What's up, guys? Welcome back to the Stress-Free NP. This is the first video of a new segment on pharmacology, and we're going to start going over different types of drugs. We're going to go down step by step on how to break those drugs down in order to better memorize them and do better on your tests. So let's start. Today we're going to talk about beta blockers. Okay, beta blockers are used for a variety of things, either in the hospital system or in the outpatient setting. So the first part, if you watch my last video on how to memorize drugs, is we're going to talk about the class. So the class is beta blockers. The beta blockers have a specific ending to help you memorize them. That ending is LOL. Any medication that's ending in LOL is a beta blocker. Now, what does beta blocker mean? If you saw my other video on alpha and beta adrenergic receptors, we know that beta has beta 1 and beta 2. Okay, beta 1 controls chronotropy, which is heart rate, and it also controls inotropy, which is contractility or the heart's ability to pump. Beta 2 is in the lungs, and it causes bronchodilation in the lungs. So that's what beta means. When we talk about beta blockers, the beta adrenergic receptors are activated through epinephrine and norepinephrine in the body during your fight or flight responses. This medication or these medications are going to block that response and cause the opposite effect. So let's go over the names of beta blockers. Like I've said, we're only going to need the top 3 beta blockers. The first one is metoprolol. This is the most common beta blocker you're going to come in contact with. And metoprolol is cardioselective, meaning that it's going to focus more on the heart, or that beta 1 adrenergic receptor, which focuses on contractility or the pressing and squeezing of the heart, and chronotropy, which is your heart rate. Okay, the metoprolol, whether you're talking about the generic name, which is Lopressor, or Toprol, don't really activate beta 2. So these medications are gonna be okay in patients who have asthma, but still something to question if you do come across a patient with severe asthma on a beta blocker. It's always good to question just to see, make sure that this medication is okay to give this patient. A second common beta blocker is labetalol. This can be in PO form or an IV push form in the hospital setting. This is a non-selective mixed beta blocker. So you're going to activate beta 1, which is going to be your chronotropy and inotropy and heart rate, as well as beta 2, which is your lungs and your bronchoconstriction. This is a medication you definitely do not want to use in asthmatic patients. This is also going to block alpha 1, which is alpha 1 causes vasoconstriction. So this is going to cause some vasodilation as well, opening up those blood vessels and allowing the blood pressure to come down. The third beta blocker that's most common is carvedilol, or Coreg. Okay, this is also a non-selective beta blocker. So you're going to get your beta 1 adrenergic receptor. You're also going to get your alpha 1 receptor blocking there as well. So you're going to lower your heart rate and you're going to vasodilate. Indications for these medications. The obvious: high blood pressure. You have high blood pressure, you want to dilate the vessels in the periphery to lower that blood pressure. You want to lower the heart rate to decrease the amount of blood going into the body at a slower pace, which can also lower blood pressure. Tachycardia, these given for many tachycardias, such as either tachyarrhythmias or atrial fibrillation. These medications are given for these types of tachyarrhythmias. Another one that many people don't know is when people have a myocardial infarction or a heart attack, one of the gold standard medications is to give this patient a beta blocker, even if they don't have tachycardia or high blood pressure. And the reason for this is when you have a heart attack, either you have a myocardial infarction, so you have infarcted tissue or dead tissue, okay, or you have ischemic tissue or damaged tissue, you're going to have the decreased ability for your heart to contract. Okay, so you don't want your heart beating very fast, because if your heart beats fast and you have decreased heart muscle to keep up with the quickness that your heart is beating, you're going to decrease the amount of blood that goes to the body, your blood pressure is going to drop, and you're going to pass out. So what beta blockers do is they control the heart rate, and they allow the heart to beat slower, allowing the blood to fill into the ventricles at a slower pace. So when they're actually full, then they can squeeze and push blood out to the periphery, and that is a more controlled pumping action for the heart for someone who has damage. Contraindications are the obvious: low heart rate, bradycardia, hypotension, low blood pressure are true contraindications to giving a beta blocker. Another contraindication, like we spoke about earlier, is asthma. You don't want to give asthmatic patients a beta blocker in an uncontrolled setting, especially patients who have very severe asthma, because you're going to push them over into an asthma attack. Side effects. Remember, top three. We're doing top three for everything. And like I said in my other video, these things are going to overlap. Your side effects are going to go into your contraindications. They're going to go into your nursing indications. So you're not going to have to remember 333 for each one. They're going to overlap. So side effects for beta blockers are low blood pressure or hypotension, low heart rate or bradycardia, shortness of breath in asthmatics, and also another thing, especially which is for males, is it causes impotence or inability to get an erection. Okay, this is a decently common side effect, and it's more of an intolerance that will cause males to stop taking their blood pressure medications, and that's an indication to maybe we're going to have to switch to drug class. Some nursing considerations for beta blockers in the hospital setting. Before you're administering this medication to your patient, you want to take a blood pressure and you want to take a heart rate. Okay, any question that has vital signs in it that are abnormal, you're always going to want to notify the provider before giving that medication, especially if you know that that medication affects one of those vital signs, which in beta blockers they do. Thank you guys so much for watching. Really appreciate it. If you liked the video, please like and subscribe so you don't miss any weekly video updates, and we'll see you next time.